My name is Jane Griffiths. I'm the Director of Nursing at Rashid Hospital here in Dubai, and at the moment I'm also sitting on the scientific committee for the second ADMC Nursing Conference. This is part of the Abu Dhabi Medical Congress, which is going to be held in October this year. I'm delighted to participate in this process. Nursing in the UAE, the same as it is everywhere else in the world, struggles with trying to actually recruit and retain nursing staff. And this is one of the very important strategies for us to be able to, one, make sure that our nurses know that they're important and that they're important enough to have a conference held for them. And secondly, to be able to bring in speakers who can provide the most up-to-date evidence-based knowledge that they can then share with their colleagues, which at the end of the day improves patient care, the most important thing that we're actually after. The topics of the conference are varied, so we're hoping that we will actually pick up interesting aspects for nurses from everywhere. As you're probably aware, nurses work in the community, they work in hospitals, they work in critical care areas. And so what we have tried to do is to make sure that we can make this conference interesting and relevant to all of the nurses. So we have sessions that are community-based, we have sessions on paediatrics, critical care, clinical aspects, education aspects. For the first time we're introducing web-based and IT for nursing, and as well as that at the end we have a whole day that's focusing in on management of nursing, which means that we are actually able to recruit and retain our nurses because we value them. There's an exciting topic within the conference as well, and it's the first time that we've tried to do this, and we're hoping that we'll lead the world in making interesting aspects, and that's really a session that's problem solving. We've asked nurses across the UAE for questions that they find difficult to solve, and we've already got a large number of questions that have come in that deal with things like, how do I talk to a family when their relative is going to die? How do I deal with situations where I'm not quite sure legally what I should be doing? And we've got experts from all over the UAE who are contributing to the answers, and on the day we will talk about the question, talk about possible solutions that our nursing staff across the UAE can use to make the patient care better. For me, one of the most important things that nurses are going to get out of this conference is not only gaining up-to-date knowledge by exciting speakers, new ways of actually delivering information, new topics that we've not actually covered within the UAE before, but one of the most important things that they're going to gain is an opportunity to network with other colleagues. Those colleagues may be from the UAE, they may be from the clinical area that they're working in, they may be from other countries. Every single person there will absolutely benefit from this opportunity to exchange ideas, to talk about what life is like in their organisation, and to take away great examples of things that they can change that's going to improve the organisation that they work in, and again, the patient care that they deliver.